Remote patient monitoring, or RPM, is quickly becoming one of the biggest shifts in modern healthcare. In 2026, the big question isn't if RPM will expand. It's how much it will cost, what drives those costs, and how healthcare organizations can implement RPM efficiently. Remote patient monitoring allows healthcare teams to collect and review patient health data outside of traditional clinical settings, usually in the patient's home. That data is transmitted electronically to providers, who can evaluate trends and make timely care decisions. RPM is especially valuable for chronic conditions, where ongoing monitoring can help prevent complications before they become emergencies.
Most RPM programs have three essential elements. First, devices and sensors like blood pressure monitors, glucose meters, and wearable trackers. Second, software platforms that collect and process the data. And third, secure communication technologies that transmit data reliably between patients and care teams. When these pieces work together, providers get continuous visibility without requiring constant in-person visits. RPM improves care for both patients and providers. Patients can stay in familiar environments, which reduces stress and improves comfort. Providers gain access to real-time health trends, helping them detect issues earlier. And clinical teams can make better, data-driven decisions using information collected over time. Most importantly, RPM can reduce avoidable hospital visits and help healthcare systems use resources more efficiently. Right now, RPM programs typically cost between $100 and $150 per patient per month. That number depends on the type of devices, the software platform, and the services included. RPM costs generally fall into three categories. First, device costs. That includes the purchase price, maintenance, replacement schedules, and technical support. Second, software and integration. This includes data storage, analytics tools, and the ability to integrate with an existing electronic medical record system. And service fees. This includes professional review of data, system updates, staff training, and patient support.
Even with strong benefits, RPM implementation can be challenging. Healthcare organizations need to address data security and compliance, integration with existing systems, staff training, and patient engagement. Without careful planning, RPM programs can create extra workload instead of reducing it. By 2026, RPM costs are expected to shift. On one hand, device prices will continue to decrease as manufacturing improves and adoption expands. At the same time, demand for advanced analytics, including AI and deeper EMR integration, may balance out those savings. The real story of RPM in 2026 is that technology will improve, but integration and workflow efficiency will determine total cost. This is where Lifepoint Informatics plays a key role. Lifepoint specializes in integrating patient monitoring data from RPM devices directly into physician EMR systems. That means providers get accurate, timely patient data without manual data entry, disconnected systems, or information silos. Lifepoint's interfacing solutions help streamline data exchange, improve data reliability, and simplify workflow integration, so clinical teams can focus on care, not administration.
Artificial intelligence and machine learning are transforming RPM by automating pattern recognition and anomaly detection. That means earlier warnings, fewer missed complications, and reduced manual monitoring. At the same time, the Internet of Medical Things, or IOMP, is connecting devices into standardized networks, improving real-time data sharing and making RPM programs more scalable. Remote patient monitoring will continue to expand through 2025, and costs will depend heavily on how well programs are implemented and integrated. Healthcare organizations that plan proactively and partner strategically will be best positioned to deliver connected, patient-centered care. To learn how Lifepoint Informatics supports RPM initiatives through secure, reliable EMR integration, schedule a demo today.